Now you will have the occasional dog. Often you will have a dog that keeps flipping around side to side and you can't get him to in the right position, and you're going to have to change your leash into another hand. But you're going to have the leash in the same position. My body's still going to be in the same position. I am going to have a firmer grip on the collar, and ideally my dog, well, not ideally, my dog needs to be perpendicular to my knees, and yes, directly in front of me. Sorry, I was going to feet. So he needs to be directly in front of me, perpendicular to my knees. Again, if you have a dog that's moving around a lot, you may have to switch sides. Just whatever the dog's going to do, you just need to keep in mind your positioning and what can I do to get him in the optimal positioning. For this one, I have a firmer grip on his collar, so I do have my entire fist on his collar. For this one, if you don't remember anything else about positioning, please remember this. On this one, it's very, very important to lock your elbow into your knee. The face was minimal restraint. This is more restraint, and this is a little bit more invasive. So if you get an aggressive reaction and you don't want the dog, if your elbow is up here, you don't want the dog jumping up, and now you have no control because he may be a big dog, like Perry here, and I can't lock my elbow fast enough. So if you have your elbow in your knee and he comes at you aggressively, he's not going to get any further than the length of my forearm. Do you have any questions about that? It's really, really important. What's that?
He said, no, he's just going to tear into your forearm.
It's better than my face. Yeah. It's a lot better than my face.
This test is designed so that it's, for the vast majority of dogs, their head's going to turn the opposite way. So that's an additional safety on this test. She'll show you.
For this piece, I do like him looking away from my face, and my hands. So I will swing my arm around this way or call him around this way. So he's looking that way, and then I'll begin. If he's looking this way, it just makes me uncomfortable, and you'll find that with your experience. He may make you uncomfortable if he's just looking this way and you go to touch him unexpectedly with minimal pressure, and he may be freaked out by that. So I do like him looking away. So I'm going to lock my elbow. I'm going to try my best not to lean over this dog. Becky's going to show you if you're on the knee, or if you have a small reindeer, how you're going to do this one, or small retriever. North Pole Retriever. I like that. NPR. It's the NPR dog.
On little dogs, if you can't get your whole hand in the collar, which does happen sometimes, if they're like 10 pounds, I'll usually use my fingers, and that's enough for me to be comfortable.
As long as you have that elbow locked, that dog's not going to come at you anyway. As long as you're firm grip of that collar, he's not going to be able to get you anyway, or your face anyway. So for this, I'm going to start at the collar. I'm going to go down to the hip. I'm going to come back to the collar, back to the hip, and end at the collar. I start at the collar, I end at the collar. So if you want to try this on your arm, we're not going to hurt the dog. The pressure that you want to apply is if you grab the skin on your arm with your palm and your fingertips, not your fingernails, your palm and your fingertips, just till you feel a little tension, and then you're going to slightly twist a little bit. That's as much as you want to grab the dog. Just slight twist, palm, fingertips, or palm and bottom of fingers, not nails. If you have a smaller dog, like a Chihuahua or something, you're not going to want to use your whole hand because this is his entire abdomen. You may want to use a couple of fingers and do that way. So the way this looks is I'm going to start here at the collar, grip and twist, move down a couple of inches, grip and twist, all the way down to his hip. At this point, I am leaning over him just a little bit. Just be conscious of where your body is. Then I'm going to come back up to his collar, back down to his hip, back up to his collar. And I'm still going to be communicating. He's leaning into me, his body is soft, his ears are relaxed, his mouth is closed, his tail's down, and my observer is going to be communicating what she sees. He's submissive grinning or whatever he may be doing at the time.
This particular test item, if you think about it, it's a period of time that you have your hands on the dog. So the dog's behavior may change in that period of time. So often we'll say, he's a bit stiff, he's loosening up, now he's soft. And these are all things you're gonna write down, because it means that at some point the dog relaxed enough for that test item to soften his body. A lot of times they won't, they'll stay stiff the whole time, and you'll write that as well. But if you're noticing a change in the behavior, be sure and notate that on your data sheet.
Another thing that I like about the safety of this test, if you have a dog, often has happened where a dog will act aggressively, and he wants to turn to bite this hand that's doing this piece of the assessment. If you are in proper positioning, he is not going to be able to reach your hand. Often a dog will try to turn and muzzle punch. You may know what a muzzle punch is. It's a precursor to a bite, where he does before he bites you, or it's just a warning. I will bite you if you don't stop. Often I've had dogs that try to turn and muzzle punch me, but if I'm in the proper positioning, I've never had one make contact with my hand. So your positioning is really important as well. What else about?
If you have a dog that does, we had a couple of dogs that screamed during this assessment. Notate that and stop. Sometimes it can be an indicator of pain. So if it's a dog within your shelter, you may want to have a vet check on them and see if there's back, neck, hip issues, things like that. That's another great thing about this portion is if they're having pain somewhere and it seems like a pain response where they scream but they're not necessarily aggressive, write it down and have somebody take a look at it.
It's also a way that we have discovered lumps and bumps.
Oh, yeah.
We have found big masses on dogs that have big matted fur, or if they have matted fur will cause a scream sometimes. That can be really painful. But we have found lots of bumps on really fluffy dogs that way as well. And at that point, you would want to stop because that's not a dog that's going to go on rescue wagon anyway.
Would you reevaluate after a groom if it would matter?
Sure, sure. Your evaluation should not happen less than, your reevaluation should not happen less than 7 days, right? Is that what's
That's our rule of thumb. I don't, I would say for a dog that, if it's just a groom issue, I think I would go ahead and do it. If it's like, something that a simple procedure will take care of, not that all grooms are simple, but, I think I would go ahead and do it in that case, just go ahead and do it.
If you have a dog that does not pass, he doesn't get all 1s and 2s, he's not rescue wagon eligible, you can retest him after 7 days, after, whatever you need to do to get him a vet check, or, if you have behavior modification protocols or whatever, and then retest him after 7 days. You don't want to do it any less than 7 days unless it's something as simple as just a groom issue. You might not get the best results, so I would keep it at 7 days.
Is it, okay, like it might just be because Carrie's really soft, but petting after that particular part? Or petting during this whole?
It can be, petting, you want to keep to a minimum. I was petting Perry as we were talking.
You love him.
I love to pet the dog. You want to keep it to a
You
minimum.
don't want to get, what we're trying to avoid is, it's real tempting sometimes to get all gushy with them. And it's like, oh baby, and just getting all up in their faces and all that kind of stuff. We don't want to be unkind to them. We want to kind of be just a little neutral. We just I'll be honest, when I do sensitivity, or what do we call it now, body, I do give them a stroke at the end. Or
It's very common to when you finish this last one, you do this. It's almost like an automatic reaction that you do this. Something you want to. Something you want to avoid doing if you're going to be petting the dog during your assessment is patting him.
Yeah.
If you're going to be petting the dog, stroke him. Patting him can get him really amped up. And if you have a dog that's really, really excited, petting might get him really amped up. Keeping your hands off of him may help him to calm down a little bit. You don't want to get him too worked up where you can't complete the assessment.
And if you think about talking and stroking, it's designed to comfort the animal, which means you're trying to alter something about his behavior. We don't want to do that. The assessment is, we're looking at what he's going to offer us without us really trying to change
Grooming
anything.
issue. Will rescue wagon take shaved dogs?
Yeah.
Yep. Sure.
Yeah, and I think to talk about the retesting, I would really minimize how many dogs you retest for behavioral reasons, because it's possible that things are gonna pop back up again. If we're seeing them in one situation, they might pop back up again. I'm kind of hesitant to encourage you to retest, so, but there are times when, you know, you think something's
Or they're
going
sick,
on.
or-
Yeah, depends on the reason for the fail, I guess.
Right.
We also had, our teams, we wouldn't assess a dog more than twice. If we assessed him once and he didn't pass, we assessed him again a week later or a month later, whatever it happened to be, and he didn't pass again, that generally was, we're done. He failed twice, we gave him another chance and he didn't pass, so we're not gonna waste our time again.
Enough new dogs that you can,
Yeah.
it's better that you move on to the new dogs than keep trying to go back to
Right.
the
Well,
old
and they'll
Yeah.
figure it out eventually.
Yeah.
Yeah,
Any,
yeah, it's just like, why not spend that time on the chance of a
study.
dog when
Yeah.
you pretty much know this dog's
Got
not
it
going
this
to
time.
pass.
Got it.
So any other questions about body?
If you do have a dog that's matted and